the whole time. You can just...
Hi, everybody. I'm here with Dr. Kiwi from Hello Ralphie. And today we're talking about all things inflammation and joint pain. This is a huge topic. We have a lot of dope dogs asking us many questions around inflammation, the causes, joint pain, and we have a lot of things to cover today. But before we get started, I'd love for Dr. Kiwi to just give a quick background on yourself and how you got started in the industry. And then we can jump into all of our medical related questions.
Okay. I've been in the field I've been a vet for 20 years now. And I was in the field for about 10 years prior to that. So for a long time, I worked as a technician, reception, all that kind of stuff ahead of time. So I've been around this kind of stuff for a long time. I do a lot with dogs, cats, and horses. And I've worked a bit with some of the pocket pets and other things like that too. So, but have dealt a lot with joint inflammation and just basic inflammation of the body and different reasons and different points, but distinctly joints in dogs for sure. And sometimes in cats too. They get more arthritis than people realize. So yeah, I've been a part of this kind of thing for a long time. And I think I have my own level of arthritis. So I totally get, the more we can do to prevent problems and catch it earlier, the better.
Yeah, I was just going to say, I mean, this is very common in humans as well. Like, we're always looking for ways to reduce inflammation, and it affects our dogs just as much. So I'm glad it's good to hear that you've seen this a lot and that we have lots to talk about. So I'd love to kick it off with kind of taking a little bit zoom out, because we throw around a lot of the words inflammation, arthritis, like what does this all mean? What's the difference? So my first question is inflammation the cause of joint pain, or how are they related?
You can have joint pain for different reasons. Arthritic change and other things like that, or any kind of change or damage, irritation, any type of problem going on with your tendon, ligaments, that kind of stuff, the soft tissue associated with it. So the joint capsule, yes, the inflammation is often in an arthritic situation is often the underlying cause. You can have other things that can cause pain though in a joint, which can be an increase in fluid that's built up in the joint itself that's creating pressure, which then there causes inflammation or stretching, those kind of things. So you can have different reasons for pain, but if you specifically have arthritic change where you've got bony changes that are triggering all these little chemicals in the body, and then they trigger an inflammatory response, that inflammation creates a swelling, and just like if you had a bug bite and it got swollen. Oh, my fiance just got home and everybody went wild. Sorry for that.
You're welcome, committee.
Live. Oh. So yeah, my little palm thinks everything's gonna go nuts. Sorry about that.
No worries.
So anyway, anything can cause inflammation, and most of the time though in our patients, you have to assume that there's potentially a certain amount of arthritic change or something like that can be part of that. So they can be related, but they don't have to be. I guess is the best way to say it. But to caveat to that, I would say they're often related, especially in dogs as they get older and issues that are going on. So.
Okay. And then the one with the joint issue with the fluid, is that one where that would come before the inflammation, or does inflammation always precede the issue?
It kind of depends on the circumstances. The fluid I would be talking about would be more associated. We'll say you had an autoimmune condition. So you might see more fluid in a joint that has a torn cruciate or something like that. And so you're going to get fluid in there, which is going to cause that problem. So that situation, yes, it would come before the inflammatory change. But arthritic change and other things like that. So it's a little bit hard to say for sure. It's almost a chicken and egg situation.
Yeah, that's what I was thinking.
Right?
Yeah.
So sometimes it's hard to know for sure which came first, the fluid or the inflammation. But, if we can identify something in, like say on an x-ray, that shows that there's bony changes there, then the inflammatory change is probably the primary underlying cause. And then because of that, you're going to get some fluid built up potentially in the joint. So, like I said, you can go kind of one way or the other. It just depends on the circumstances and the stressors that individual has to undergo. So say you have a 120-pound dog versus a dog that's only 6 or 7 pounds, the way their joints are going to react to things is going to be completely different.
Yeah, that's a good point. So they seem to always go hand in hand at some point,
Yeah.
regardless of what came first.
Yeah.
That's a good segue into our next question. How do you know if you're dealing with arthritis, osteoarthritis, or
Okay.
just a joint pain or inflammation? Is that one and the same?
No,
Really?
not necessarily. Osteoarthritis is going to be associated with true bony changes. Now, the problem is in the early stages of that, you might see cartilage start to change, so that cushion over the end of the bone is going to start to change, which then leads to bony changes. So the bone itself, you can see uh, it'll look, instead of smooth, it's going to look really bumpy, and on an x-ray it's going to have a different appearance than it would if but you can't see cartilage on an x-ray. So that's where you might see that you can see something that looks inflamed around the joint. So say the joint capsule, yes, you can get fluid in that situation. So you can have early changes where the cartilage is being damaged and you can't see that on an x-ray. The only way you're going to see that is with nuclear medicine, and where they put dyes in and that kind of stuff, where there's different things they can do where they can look for that, but it's not something we do in general practice for our pets. But you can assume if there's pain and you don't see anything on an x-ray, under certain circumstances, yes, there's a potential chance you've got arthritis starting in there. So an arthritis just means you've got overgrowth of bone. You've got bone that's being hyperstimulated. So because it's not moving, the joint's not moving right, you get extra bone growing on surfaces that should be smooth. And so now when the joint is trying to move in a smooth fashion, it's like going over a gravel, a smooth road, but now has gravel things sticking out the top of it, basically. And as you wear away the cartilage, once the cartilage is gone, you can't get it back. So now all of a sudden you've got this bumpy road with gravel sticking out and pointy, and you don't have anything there to smooth it out and keep it smooth anymore. And you can't put a new layer of asphalt on it, like you could on a road, to get it smooth again. So that's where you start. So early on you may not see that. So I'm not even sure if I went totally off topic on your question or not.
No, you went into the next question, which is great too. But is that what they mean by like bone on bone, like when it's hurting?
Yeah.
Oh my,
When
it
you
just
wear
sounds so
down the cartilage, or the cartilage starts to become thinner and thinner, or the bone overgrowth becomes more prominent than the cartilage that's still present, you can get the bone on bone effect. And that's where you're going to get the grinding. Like when I go up the stairs, my knees make all kinds of funny noises. It's that clicking, popping, what we call crepitus in the medical world. And that's where you're going to get that grinding sound that you'll sometimes hear. And I would say you could probably hear it more in yourself than you could in your animal, but it's still possible it can be there. If you flex a joint on a dog, especially a big dog, and there's arthritis in their knee, sometimes you'll hear that kind of crinkly, and you can almost feel it. It's a creepy feeling, but yeah.
And at that point, they've probably graduated from just some inflammation and joint pain to actually having an issue with the bone, and that would be arthritis already.
Yeah. And I mean, yes, it can get more complicated with that. If you start getting into things like cruciate injuries and hip dysplasias and other things like that, elbow dysplasias, there's all kinds of different, let's put it this way: arthritis in itself and the inflammation associated with arthritis are very general terms, because there's such a broad possibility of reasons. And yes, you're going to have the more common things, you're going to see them more commonly than you will the less common things. Like you're not going to see an immune mediated arthritis as often as you'll see osteoarthritis, because osteoarthritis comes from over compression and forces on the joint that over time cause problems. And that's where you get into weight and other things like that, because inflammation in the joint is one thing, but you can also have an overall inflammatory process going on in the body. So if you have too much weight on your body's in a state of perpetual inflammation, which is going to cause inflammation in other things, which there causes inflammation in your joints themselves. And that's why, that's why we are intent not only on getting the weight down to put less pressure on their joints when they've got inflammation, but also if you can bring the whole level of inflammation down in the body, you're going to also help the aches and pains that come with that, because it's all that other stuff that causes your muscles to hurt and the tendons to ache and all these other things like that cause pain as well. It's all the what I would call the ancillary pain. That's where you get benefits from things like chiropractic or or acupuncture or herbal things like that.
Okay. So you mentioned the weight being a strain on the dog, being overweight. What else can we look out for that might be a cause of this? Like, so that we can kind of get ahead of it. And then we're going to talk about early signs specifically, but
Okay.
what actually causes it? Is it always like the weight or the pain, or, I mean,
Well,
it could be a number of things.
Yeah, I mean, arthritis itself, you can presume that, let's put it this way. If I have a dog that's anywhere over 45 or 50 pounds, by the time they're 6 or 7 years old, I'm going to assume that we've got a certain level of arthritis starting potentially in the back and maybe in the hips, maybe in the knees as well, or even the shoulders. If you get a giant breed dog, I'm going to start assuming that somewhere around 3 or 5 years old. And if you look at what they tell us from the perspective of getting preventative changes in place, so say glucosamines, chondroitins, any kind of anti-inflammatory products, some will respond to CBDs, other things like that. So getting that in place before you lose the cartilage is really a key factor, because if you can keep the cushion there and you can keep the good flow of joint fluid there, you might be able to slow down the progression of that overgrowth of bone. So yes, so that's one thing. And keeping lean weight over time is going to help prevent that as well, because there's less extra pressure the joints are having to take when they're impacting. Like, so even an animal that's over, so say a dog that's, 45 pound, 50 pound lab, is fairly small, but is overweight, is going to still put as much pressure on their joints as a dog that's closer to 100 pounds. But then you get into the giant breeds like St. Bernards, Mastiffs, that kind of stuff. Any of those guys, Great Danes, I'm going to assume we have potential early cartilage changes as early. And some will say, if you look at some of the research or some of the stuff they'll tell you, as early as 3 or 4 years old. So I will usually start telling people, start a glucosamine supplement, as soon as you can, like, or somewhere around 3 or 4 years old. And then you kind of see how they do over time. And then just being really careful to keep their weight, as lean as they can. So yes, you're going to, the hard part is that a little dog can have just as many arthritic changes. They just tend to be in different places. So your big dogs are going to tend to have it in their hips, their knees, their elbows, their back. Little dogs, they can have them in some of those same places, but you get a little, so say you got a little dachshund that's got the crooked little legs and the legs are all, displaced and they're not straight. Those dogs are going to be prone to arthritis fairly early on. And, then you have the complications that potentially back problems as well. So, it's, which may or may not be arthritic based at all, but any kind of, and then you've got injuries. So a cruciate injury. So a dog blows the ligaments in its knee. Well, that inflammatory change and the actual fact that you've now destroyed the thing that holds the knee in a stable position, the instability creates abnormal rubbing, if you want to use that word, or friction between bone, cartilage, and everything else. And so that's where you're also going to get problems, because now you've disrupted the normal mechanics. So any of the things, and it really came down to it, I think if you disrupt the normal mechanics of a joint, whether it's because you're built wrong, so say you have a conformational, dogs that are too straight in the knee, they don't have enough bend in their knee, there's lots of different things. You're a giant breed and these dogs are not, it's not like a horse. They're not built the same way, where they have the capacity and the bone changes that actually support the fact that they're such a big animal. So their bodies break down quicker. The forces are much heavier on those joints. All of that stuff, the way their backs have to sway with the amount of weight they have to carry in their belly, those kind of things. All of those things are going to play into the forces and the changes in normal function of a joint over time, because it's going to alter the natural ability of that joint to function the way it's supposed to.
Yeah. So no breeds are in the total clear. I was thinking, you answered that with the larger breeds getting early, but it sounds like small dogs have issues around this as well.
Yeah, I mean, you don't always see, like, spondylosis is what we'll look for in the back, and that's where they get arthritis in essentially the lower part, so the part of the vertebrae that's closest in the back, that's closest to the abdominal cavity. So, and that's because you get the bending and the flexing of the back. Well, I've seen that in little dogs, or certain breeds like French bulldogs, in any of the bulldog breeds, the English bulldogs, because they're shaped different. Their spine's not quite the same shape. So the way breeds have been created over time, we've also created some of our own little nightmares in those things. And some of those dogs never have problems, and others have all kinds of problems. So, right? So it really comes down to how that kind of, you've created a different shape, but sometimes the shape doesn't work for the way the body's supposed to work.
Yeah. Well, it is
Right?
what it is now. These breeds all exist. So what can we do? What can we keep an eye out as a pet parent early in our dog's life? Early signs of it. I guess let's start here. Like, what are early signs of it? Like, should we even wait for signs, or is this like, if my dog's 4 years old?
Yeah, I mean, let's put it this way. For an example, I have an Australian Shepherd who's 7, and if there's a ball anywhere in his world, anywhere in his vicinity, he knows it. He's got like a homing device for them, and he won't stop playing with his ball unless you make him at this point. But now he's getting to the point where he'll get it to a certain point, and I'll start to notice a limp. And I'm like, okay, that's it. We're done. But I'm also going to assume in him within the last year and a half, I've started to assume that he potentially has something that could be starting in his joints. So I've already had him on a glucosamine supplement for close to a year.
Okay.
The other thing, so, as a vet, I'm going to look at that and say, okay, well, you've got, even though he's a very slender dog, he still has the risk just with age and everything else. So, and the fact that he's active, so yeah, you have to make some assumptions. The little dogs, it's a little bit harder to tell. I mean, because some of them are just, they don't, it depends on the little dog. Some of the little dogs, hardly ever move. Then you have the Jack Russell who won't sit still, so, but it's, so you have to just watch to see, okay, how do they do with, are they still jumping up and down like they used to, or do they seem to not want to play like they used to? Or are they still playing with their toys? So what you're looking for is variations of their normal. Just like us, every animal, every person has their normal. And so as the pet parent, if you're paying attention, you're going to know your animal better than anybody, whether your vet tries to tell you that or not. You are. And so if I have a pet parent telling me something's not right, I can tell that something's not right with my animal. Even if we can't distinctly find anything, I can do diagnostics till I'm blue in the face, but that doesn't necessarily mean I can distinctly find what's causing the pain. Because at that point, if it's soft tissue based, it may not necessarily show up on anything X-ray based or anything. It won't show up on blood work, anything like that. So at that point, as the doctor, what I'm going to say is, okay, well, let's try, I may suggest some certain activities or avoiding certain activities, or I might say, well, let's try a course of pain medication for a week and anti-inflammatory for a week and see what happens. Do they get better? If they don't, then maybe not. I've had circumstances where we thought it was arthritis and a dog ended up having Lyme disease. So that's where it is still important to don't just assume that, okay, well, they hurt themselves in a hole. They're not better in a couple of days. They need to be seen because something could be going on that you don't even realize happened. And they can't tell you except doing some, even if they look better. The other problem you always have to be careful with in dogs is they have what I call the invincibility clause. Because if you right? Pain is a physiological response and it's there for a reason. And part of the reason we have pain is so that we don't overdo it. Well, you cover that pain up or reduce that pain with too much pain relief. And then now all of a sudden, it's not that don't get me wrong. I don't want my pets I don't want an animal to be in pain, but you also, if a dog is not associating the pain with something movement based, they're just going to do it anyway. So if they think that it doesn't hurt anymore, it doesn't mean they've healed. So just because they can do something doesn't mean that they should. So you really need to listen to your veterinarian's instructions with regard to how long you should rest them, and that, just like us. I mean, if you sprain your ankle, you have to take a certain amount of time off for it to heal, even if it feels better. Okay?
Yeah. I was thinking about the pain, their high pain tolerance, because I know my dog, she would just run right through it. And I wonder, when would she actually say, no, I'm going to stop playing? It would have to hurt pretty bad. Yeah.
And that's the hard part. Dogs in particular, definitely certain breeds are going to be much more stoic. You've got some dogs who are uber dramatic about it. And then there's others, but majority of them, especially pit bulls, Labradors, any of that type of breed, any breed that's really driven for play, or is really, so it really can be any dog. And it can be the small dogs too. Some of them are just as stoic as the big dogs. So, you have to be wary of the fact that, okay, well, usually they'll play they'll play for 10 minutes, but today they seem to stop, or they, things like going off their food a little bit, or not a lot, but even just a little bit out of sorts. They didn't want to eat their dinner tonight. So if you're seeing that persistence, if you rest them for 24 hours and they're doing okay by the next day, you can see how it goes.
Okay.
But it's, so in a young dog, if say 2 or 3 year old dog, yeah, take a break, give them a day off, and then see how it goes tomorrow. But just realize that if you push them too far, if you're still in the soft tissue part of that, and you've strained a muscle or, something like that, you can actually tear the muscle if you push them too far. Yeah. So it's really hard, because dogs are so hard. It's not like a kid where, when my daughter was little, she told me her arm was bumping one time. It took me probably a couple of days or longer to figure out she meant that she had, then she told me her head was bumping, and it finally clued in. She's got a headache, her head's throbbing. But, a dog can't tell you that. You might just see some, they don't want to do one activity or not. So let's put it this way. I do this for a living, and I still can't always tell. But, so a lot of times it takes me doing manipulation of the joint or certain stress on a joint or a part of the body to get an indication they're truly painful. But a dog that is usually really much about they like their food, or they do certain things, but they don't want to do those things, or they seem out of sorts, they're tired. That could be an indicator, because those are the things that if you're telling me that as the pet parent, and you're in my room and I'm trying to figure out what's wrong with your dog, and you're saying, well, he hasn't really wanted to eat very much last couple of days. He seems, he still wants to go for a walk, but then he just, those little triggers, those are some indicators of pain.
Yeah. You got to be really in tune with your own dog. Yeah. That's some good advice for sure. So say you get to the point where you've monitored them for 24 hours and they're still not behaving with their normal way. What would you suggest? I know you mentioned glucosamine as a great supplement, but what are some of the medications that you might be giving a dog that actually is in pain and needs to deal with this on a higher level?
First of all, I would say there is no safe over-the-counter medication for inflammation for dogs. Whether they sell a dog aspirin or not doesn't mean that it's actually safe for them. Okay. There have been some studies to show that aspirin at pain therapeutic levels, not necessarily at just the basic levels. Aspirin has its place, but if you're truly using it at the levels you need to help reduce pain and inflammation from a joint situation, you potentially are putting them at risk of having microbleeds in their stomach. So you have to be really careful. Aspirin, just because it says dog aspirin, doesn't mean that it's safe for them. Dogs do not tolerate, their kidneys cannot tolerate things like naproxen, which is a leave. They cannot tolerate things like Advil. Please don't give it to them, because if you're doing something like that, by the time you actually do go to the vet, if you've given any of those things, whether it's aspirin or, most people they're more aware of Advil and a leave and that kind of stuff, but Tylenol is a no-no. 1 or 2 doses is probably not going to hurt them, but it still has the potential to cause some pretty significant damage in their body, and it has a toxicity effect in dogs. It could kill a cat with 1 dose. A dog, you might get a couple of doses before you start to see changes, but you're still not getting anywhere. So don't give anything that way. If you think that there's an injury going on, you're better to go get checked, because then we can use NSAIDs similar to, say, an Advil, but are safe for dogs. So carprofen is one of them. Meloxicam is another one. There's a whole stream of them that are in the veterinary realm that you can use that are safe. You can use natural anti-inflammatories. Some people, to prevent things, will use things like turmeric, just like they will in people. And in those kind of, if you're looking at herbal options or even glucosamines, you're best to talk with your veterinarian about what's right for your individual animal, because sometimes that's my other dog. Sometimes what we think is okay, or what you think you're getting is a good product. Nutraceuticals are not regulated like medications are. So you could be getting a bunch of junk and you're getting 10% of the actual medicinal stuff you think you are. Yeah. And just because the food says it has glucosamine in it doesn't mean that it's therapeutic glucosamine. So because even they will tell you, even with the diets that are so your prescription diets that are designed for a joint, even that they will tell you these aren't necessarily therapeutic levels of glucosamine, and you still might need to use something different or more. So those are some things that you do in a natural way to prevent arthritis. And then if you actually get into a situation where you need something, then you're going to need, and any kind of insight in a dog, they don't tolerate them the same way. And that's why one of the reasons we find it very important to do blood work with these kiddos to make sure they can handle these drugs. So you don't send them into kidney failure. We don't do stress on their liver. We don't overtax their stomach. There's a lot of different things that can go on. So,
you guys ever prescribe the prescriptions for a shorter period of time? Like, say it was going to be a little bit harmful to the dog, so maybe you do a lower dose for a short period of time. Because I know with our dog, he was prescribed something, but it was basically, you can't be on this forever. So then I'm like,
it kind of depends. Like, there are certain circumstances where, yes, they need to be on it chronically. So if you have a chronic hip dysplasia dog, or a dog that's had a cruciate injury and then is now starting to have long-term problems, those orthopedic issues, or dogs with, arthritis in their back, yes, they sometimes need to be on a daily regime of an anti-inflammatory, because the better you can keep the blood levels more consistent, the better you're going to do at controlling and keeping that pain under control as well. And in that situation in particular, you have a chronic inflammation process like arthritis, where you're not going to make the arthritis go away, but it's enough that little fits and spurts of pain relief. So say they ran too much the day before, and you put them on medication or they overdid it. They need medication for a week, like you said, a short-term situation, versus a dog that no matter you're not controlling the pain, as soon as you stop the medication, the pain comes back. Those dogs usually need some kind of chronic supplementation, and it's the inflammation that is created over time that's actually causing the pain. So by keeping the anti-inflammatory at a regular level in the bloodstream, you're going to minimize and keep that inflammation at bay. So therefore you can help minimize and decrease pain and damage, because the inflammation also causes damage. So it really kind of depends. That's something you have to really kind of figure out with your veterinarian to decide what's right for your individual pet, because just because it's right for one doesn't mean it's right for the other.
Right. Yeah. So on that note, what can we be feeding them alongside, medicines that they're prescribed or not? Like, is there something that we can look out for, or just try to make our dogs be like set up for the best case scenario so that we don't have to be on all these?
I think be careful with, picking what diet you feed is a good thing, because, you have to be really careful. The pet food market is out for their own interests in a lot of ways, not all the time. So I don't want that to sound too blanketed, because that might sound a little biased, but you do have to be careful that just because somebody in the pet food industry says this is what it is, doesn't mean there's something there to back it up. So, they need to have something there to back up the claims that they're making. And so, but whatever works, what you really want to focus on is don't force the extra stuff into your animal. Like, some dogs there's two kinds of dogs: those that live to eat and those that eat to live. And the ones that live to eat will eat whatever you put in front of them. So you have to be careful. Right? You have to ration. You have to at least give them a set amount in a day. And if they, if that's what they get, and if you want to supplement with extras, like, some vegetables or something like that, so they feel more full, that's again something you have a discussion with your veterinarian with, because you got to make sure they don't have a thyroid condition, that there's not other factors that's causing in that. But aiming towards keeping them as lean as possible is your best bet right from the time they're babies. But the other thing too is, at a certain point deciding, okay, when do I add in something like glucosamine? If you add it in too early, you're not going to hurt them. You just may not do anything with it.
Yeah.
So it's essentially what the glucosamine chondroitins are doing is just protecting the cartilage that's there and preventing it from being broken down as easily, and preventing it from getting as inflamed. So starting it a little early is not a big deal, but you're not necessarily helping them either. So, I don't think you're hurting them, but I don't know that, and that's the hard part, is you can get into all kinds of supplements. So, yes, there's a lot of those. So yes, food, being careful with, I honestly don't think of any specific foods that trigger inflammation. I know it's a topic of discussion in the human world.
Yeah.
And we don't really know enough about that to dictate that this particular food is an inflammatory trigger.
Okay.
I don't think that you can necessarily pinpoint something like that in dogs, because they are different than we are. We assume they're like us, but they're not. So you have to be careful in using those kind of things. That just because it works in the people world doesn't mean it works the same way in a dog's body.
Yeah.
Okay. So having them on a balanced diet, minimizing, the cruddy stuff that can cause inflammation in us, like, any kind of, don't share your French fries. One French fry is not going to hurt, but, be careful sharing your food with them. I mean, I'm not going to deny that I don't give some of that kind of stuff to my dogs, but most of the time my Pomeranian goes nuts over broccoli of all things, but she loves broccoli. So, those are some things that if you want to give them stuff that like eggs, things like that are lean and healthy and whole, then those are some things you can try, but don't giving them the crap is going to potentially give them the craps and also cause them problems in the future. But it's, so yeah, I mean, I think if you have a balanced diet, you're careful with how you feed them. Don't let them get too sedentary, because the less they move the joint, the less fluid gets produced in the joint, and then you have more chance of getting changes in the joint over time. So it's such a multifactorial thing. Yes, you can use a joint-based diet, if you want to help. There's ProPlan has a good one for joints. There's lots of them out there, but and those might help reduce that change, but it's such a conglomeration of things over time. You can't assume that one thing's going to help. You have to be aware of kind of all of those things. But I think if you really want to focus on it, one, know your breed, know what potential things your breed can have. So if you've got a Labrador or a Golden or any of those, your giant breeds, you can assume there's going to be some level of arthritis at some point. They're also going to have more joint problems. There's more stress on their joints. So, but don't assume just because you have a little dog, you're not going to have some of those issues. It just maybe vary. So, and then keeping them, like I said, try not to let them get chubby, because there have been studies that show you could lose 3 years off of your animal's life by having them overweight, and essentially you're loving them to death.
Yeah.
Right.
Yeah.
And, 1 or 2 pounds is different than, 10 or 20, but at the same time, you really have to be careful with weight. And that's why we kind of are there. And it's one thing, we don't want to lose 3 years off our own life, but if you think about it, you're losing more like a 6 or 7 amount of time from a dog's life, because we have them for such a short amount of time that you don't want to lose them any, faster than you have to. So keep those kind of things in mind. So really it's how you keep their exercise as best you can, or at least, and then also keeping them as lean as you can, and then talking to your veterinarian about what works or what they think could be going on, or what might be going on.
Okay, we just have one more question. We've covered so much. We've covered the causes, what to look for, and how to help it. I want to wrap up with, do you think physical therapy helps in this situation, and how would you go about that? Would your vet recommend it, or is that not really?
I think it really kind of depends. So say you have to give you an example. So say you have a dog that has severe hip dysplasia. We don't see it as bad anymore, but it's still out there. And in that case, yes, swimming, like even if you don't, it's not like you have to have an underwater treadmill in your back room, because I couldn't afford to do that. But if you have somewhere they can swim, yes, the less pressure on their joints, the better. So that type of physical therapy, absolutely. Keeping them but for them, physical therapy may just be, you may not be able to go for a 2-mile walk like you used to, or you may never get to go on a 2-mile walk with them, but going around the block is still going to stimulate their joints and stimulate the fluid production to keep their joints lubricated. So it's like, if you're not lubricating the joints, it's like not having oil in your car. Things are going to rub together. So, you have to look at, okay, just pay attention to their tolerance level. Do they seem to get tired, or they start lagging behind you at a certain point? Or some of them, if it hurts, they'll just stop. So those are some things. So your physical therapy is that. You can do that. Talk to your doctor. But getting into an actual rehab physical, like your heavy duty physical therapy, that's usually more injury based type stuff.
Okay, that's what I thought.
Yeah, that's more injury based stuff.
And then when do you have to go to surgery? Is that injury based too?
Yeah. To a certain degree. Yeah. I mean, let's put it this way. So you can't detect hip dysplasia in a dog until a minimum of 6 months old. And if you're looking to actually get their hips certified, we usually don't do it till they're closer to 2. So, but in certain circumstances, you have surgery is indicated in certain situations, but I can't blanket say that there's always surgery indicated, because yes, it may be your gold standard. So say a dog blows its cruciate injury. Yes, the gold standard is to go in and surgically repair that joint and restabilize its normal position and all the parts of it. That doesn't mean it's right for that individual dog or that individual circumstance. So you have to be careful not to blanket it's always surgery, because sometimes it's not going to work. Some believe that luxating patella in these little bitty breeds, where their little kneecaps don't have the proper groove to sit in and it pops on and off. Some will say, nope, it's surgical. Not necessarily. Most of these dogs, I would say 3/4 of dogs with kneecap problems go most of their lives and never actually have to have surgery. So it really has to be dealt with on an individual basis. You can't just blanket into surgery.
Okay, thank you. That's why I wanted to cover that, because I think, you know, sometimes it feels like the easy way out, but really it's not always. So, wow. Okay, so we covered a lot. I definitely learned a lot about inflammation, arthritis, how they're related, and how we can kind of set our dogs up for success early, and what it actually means and what's actually happening in the joints. That's all the questions I've got. Thank you so much.
Oh, you're welcome.
We covered it all.
Well, it's the kind of thing that you could talk about. There's so many different venues and avenues and little branches you can go off into in this kind of situation too. So, you know, just to kind of focus on the basics is, like I said, just keeping your pet as lean as you can. Yeah. And then being in communication with your veterinarian so that, you know, and there are different, look at pain scores. You can look up pain scores that we use that help us to determine if there's pain, that might help you determine if there's pain. There, you can just type in animal pain scores and they will help you kind of get some perspective, because they'll tell you that 1 out of 5 is this, or, you know, so that might help you determine if you're seeing some of those things. So Googling those, that's the one time I like Google, is you can usually find some adequate information. Just be careful. Dr. Google can get a little bit carried away, not but yeah.
Okay, so Googling your dog's pain score if you're concerned that they might be experiencing any of this. Okay.
Yeah. Right. So, and a lot of the anti-inflammatories like meloxicam, which is also Metacam, or carprofen, which is Rimadyl, those are drugs that sometimes if you go on their websites, they give you pain score options on how to determine those pain scores so that you can better determine if your animal actually is hurting or not. So
okay, awesome. Thank you so much. If we have any follow-up questions, we know where to find you. We'll reach out again, and I hope we can do this again soon.
Yeah, it's great. I've enjoyed both times I've been here. Thank you for having me.
Thank you so much.
Yeah, you're welcome. Take care.
Bye, everyone. Thank you.
Bye.
Oh.